everything from that point on has changed. August 13th has changed everything for me. I take every day as a gift.
On August the 13th, my wife and I decided to go to a restaurant for breakfast. We sat down and had ordered coffee and tea.
And the minute I ordered it, I started to feeling my hand go like this. And everything was moving in slow motion in my head. I was trying to talk, but I could hear myself going real slow motion, but Tim said nothing was coming out.
I noticed her left side was hanging down or out of place, so I asked her to move her left leg and she moved her right leg. So then I asked her to move her left arm and she moved her right arm. Just through training from the Pennsylvania Fish Commission in Red Cross, it just gave me the basis and foundation that you know when someone is seriously having a problem. And just to look at Kathy, I knew that there was something definitely wrong, really bad. And shortly after that, a gentleman came up who was a doctor and asked me, what's the matter? And I said, I think she's having a stroke.
The stroke program at WellSpan Health is pretty comprehensive across the region. All 4 WellSpan acute care hospitals are certified for stroke care by the Joint Commission. WellSpan York Hospital is certified as a comprehensive stroke center, the highest level of stroke certification available. Only 2% of all registered hospitals in the United States are certified as comprehensive stroke centers. WellSpan York Hospital has the state-of-the-art equipment, infrastructure, staff, and training necessary to diagnose and treat patients with the most complex strokes. WellSpan Ephrata Community Hospital, WellSpan Gettysburg Hospital, and WellSpan Good Samaritan Hospital are also recognized nationally as primary stroke centers by the Joint Commission. This certification means the physicians, clinicians, and staff at our hospitals make exceptional efforts to foster better outcomes for stroke care. The first link in the chain of survival for stroke is actually detection. The greatest outreach that we are actually committed to in WellSpan Health is actually reaching out to our community to help them understand what stroke looks like. FAST stands for Face, Arm, Speech, and Time. It's a system of easy recognition of stroke when stroke is occurring. Face is a noticeable droop on one side of a person's face. Arm is you ask a person to hold up their arm, and if that arm kind of drifts, or there's weakness, or there's paralysis, or there's tingling. Speech is, ask the person to say something. They may be unable to get words out. The words may be garbled. They may use language that doesn't make any sense. And time is brain, and it's time to call 911. Really, the sooner that someone gets to the hospital to receive treatment, the better their outcome is going to be in the long run. Treatment for stroke and the prevention of stroke is actually a team sport. And actually the care starts before the patient actually reaches the hospital. EMS calls medical command ahead of time to tell us that they have a potential stroke patient and they're on their way. We send out a stroke alert so that the team is actually mobilized prior to the patient even coming and getting to the front door. Here at York Hospital and across WellSpan at our other hospitals, the patients are automatically taken to CAT scan, where they receive CAT scan imaging to determine what kind of stroke they may be having.
They got her in the ambulance and headed for the hospital. It was just spontaneous. Everything just clicked. It was a team effort with those guys. Her right side had a blood clot, and she was having a massive stroke at this time. They needed to give her TPA, a medicine that breaks the blood clots down.
TPA, or alteplase, is a clot-busting medication. That's how most people know it. It's a protein that we give into the IV line that goes at the arteries, and it goes out for a clot inside the brain. And what happens is it basically dissolves the clot. TPA is a great drug. It's the standard of care. I think the most critical thing that we could stress to patients is time is brain. For every 1 minute you don't get blood flow to your brain, you're losing approximately 2 million brain cells. Add that up over the course of 60 minutes, 180 minutes, we're talking millions and millions of brain cells. We know that the sooner you get here, the better the outcomes are.
This is the neuroendovascular suite. This room is dedicated solely to treating brain disorders and vascular disorders of the brain and cerebral circulation. And there's a wide variety of things that we treat, but stroke and aneurysms are foremost for us.
It's a very big deal. We have the capability of not only IV TPA, we can do mechanical thrombectomy, we can put a catheter right into a clot in the brain and pull it out. We can do intra-arterial TPA, which is TPA, but right at the site of the clot. We can do stenting inside the brain and outside the brain.
We have the advanced technology to do more advanced imaging and treatment of patients who need those more advanced procedures to actually go in there, pull the clot out, and open those blood vessels up.
The day that I saw her face and she couldn't talk to me and her left side was hanging the way it was, I knew that I could lose her right there.
She had been treated with intravenous therapy. However, there's what we call a large vessel occlusion. One of the major arteries going to the brain was blocked off. We got her up here, got her set up, very quickly got access to her blood vessels, and within about 30 minutes we were able to advance a catheter up into the brain and pull the clot out of her brain. As we were waiting after the procedure for the ICU bed to come down, she was able to move her arm and leg again.
He came over and actually showed me the blood clot. I looked to the right, he goes, "Here's your clot." And he goes, "Now, what's your name?" And I said, "Kathy." He goes, "Wave your left hand." And I waved and I moved my left leg. I felt that there was an intervention that day between God and the doctors and my husband. And because of them, I'm here today.
It was a fantastic feeling. It hit me right here, you know, and it still does. You can see that. I mean, it's an emotional thing because for me to be able to save my wife's life it's beyond recognition. It's fantastic. That's all I can say.
When we have a home run, basically, where we're able to open up the blood vessel in a short period of time and patients get better on the table, it's always a great feeling.
In those situations where everything works, I'm moved to tears, honestly, because it's such a tremendous feeling. Because, you know, so many times in my career I've been moved to tears because of things that were lost, you know, and here is something that's gained, and that's just amazing.
Before this happened, I carried a piece of paper of when a person's having a stroke, what to ask, like make them stick their tongue out, make them smile, make them say a sentence, make them raise their arm. That and CPR, I keep them in my paper. Who thought I'd need the one for stroke? I feel really good. I'm tired yet, but you know, that'll pass too. But I feel just like I was before August 13th.
Look for the signs. The main thing is if you feel that there's anything wrong, call an ambulance right away. Time is the most important thing. It made all the difference in the world with my wife.
We were told. That 3 to 4 hour window is a matter of life or death, basically, yes. If we would have missed that window, I don't know if I'd be here.
Every day is a good day.
Every day is
and we try to spend it together as much as we can.
Yep.
I mean, our lives together now are probably 100% more important. I think I'll keep her for a while.